Good morning. This is Drew. He's 4 years old, and he has cystic fibrosis, a genetic disease characterized by chronic lung infections and impaired digestion. He has a 50% chance of living to age 41, and I'm here today for two reasons. First, because I'm determined to beat those odds. Second, because I know I can't do it alone. Cystic fibrosis is a progressive and fatal genetic disease that does not have a cure. I wake up every day knowing that I could very well outlive my son. Receiving that diagnosis and hearing those words, progressive and fatal, that's tough. I was scared. I am scared, terrified, actually. But being sad and scared is not a productive place for me to stay. Once we adjusted to our new normal, a life of medications and doctor's appointments and hospital stays, wandering and worrying and praying, I set out on a mission to save my son. I listened to what the doctors were telling us, taking notes and asking questions. I read medical journals and news articles. I tracked everything about him, trying to find anything new, something the doctors might have missed. And I stumbled upon other parents and patients online who were doing the same thing. I joined advisory groups and quality improvement committees that I not only learned from, but I started to contribute to. I found myself becoming empowered by my peers, and I began to see how patients, working together with clinicians and researchers, true participatory medicine, could improve both health and care. My son has a multi-drug-resistant bacteria in his lungs that has had us in and out of the hospital for the past 2 years. The medical journals suggest that he will lose roughly 4% of his lung function every year while colonized with this bacteria. What I need is access to real-time, trusted, reliable information on everything from novel approaches to eradicate that bacteria to reasons why having a certain pet could be detrimental to his health. I want to know what other parents know and have tried, and I want a doctor to weigh in on why those options may or may not be good for me. I want to hear about the tracking methods people use and how they connect with their doctor between visits, but even more, how it's improving their care. I want other patients to feel empowered, to suggest to their doctor trying something new, no matter how novel it may be, and I want the doctor to embrace that idea. I'm here because I'm trying to save his life. Access to information like this, to people, to life-saving treatment options, should not be left to the chance of a desperate parent or patient stumbling upon it on Facebook. We have a moral obligation to work together and organize this knowledge. To the doctors and researchers here, I want you to appreciate that patients and caregivers are more than their disease. I am a mother, a wife, a daughter, a sister, a niece, an aunt, a neighbor, and a friend. I have experience as a marketer, a researcher, and a photographer. I have sold Tupperware, makeup, knives, linens, and Girl Scout cookies, served coffee and Cosmos and jury duty. I am a volunteer, a blogger, and an advocate. I work on our clinical care team as a family partner so that the perspective of patients and families who experience care in a way that you may never fully understand is present in all clinical discussions. We want to work with you, and I implore you to let us help. To the patients and caregivers here, be brave. This is a tough life. There's no doubt about that. But you are very capable, and the rewards are great. There are many people like you. You can find us online, in support groups, and wandering the halls of the hospital. You have so much knowledge to share as you are the expert on you. Share that rich knowledge with your doctors and other care providers and with everyone you meet. Let your voice be heard and lead the change that you so desperately need. This is Drew. He may have cystic fibrosis, but cystic fibrosis doesn't have him. Thank you.